Can you talk about how big of a problem bone loss is, or even osteoporosis, at least in this country and probably around the world as people age?
Mm-hmm. Yeah, osteoporosis is, of course, as you know, it's a worldwide problem. It's in any society, any civilization. As people get older, there is an issue mainly in women, but an also underestimated problem in men. Mm-hmm. That's, as you age, there is a problem with osteoporosis. The exact figures depend from society to society, mm-hmm. but numbers are as high as 50% or more that you have a weakened bone structure. This does not develop in each individual into actual osteoporosis, but increased risk of fractures is a general problem associated with aging. Mm-hmm. So this makes that the problem is very, very important, and that finding a solution which works in a natural way, that is a very, very important aspect.
You said as we get older, the bone loss increases and the remaking of bone mm-hmm. decreases. If we do things right, can we reverse that trend and not have our bones be so brittle? Can we go from mm-hmm. bad to an improved situation?
Yes, in fact, what you see is that you have this imbalance. Now, there are two ways of approaching this. You can say, I want to restore this balance, and you can actually help the body to restore this balance. You can have two approaches. You can either say, I just inactivate the resorption, so I stop the removal of the old bone, and the consequence, of course, there is no degradation anymore, so you don't have further bone loss. This is a typical approach which was followed with bisphosphonates, with the typical drugs which target osteoporosis. Mm-hmm. Results are good. We see that people really develop more bone again because there is no removal and there is formation, and you can actually strengthen your bones again. Mm-hmm. Now, the main issue with this classical approach is that, as I mentioned before, that bone formation and bone metabolism is a dynamic process. You have to be able to remove old, lower quality bones and restore that and replace that with new bones. Mm-hmm. If you just stop the degradation process, you in fact stop or block this natural renewal of bones. You know? Mm-hmm. The alternative strategy that you could follow is, instead of stopping the removal, if you manage to support the body in increasing the bone formation, you can actually, in a very natural and very dynamic way, restore the normal balance in bone formation and bone resorption. Mm-hmm. So this is actually something you can do, and something that we showed also in a 12-month clinical trial.